Please welcome everyone, Fabian.
All right. Make it big. Cool. My name is Fabian. I'm one of the founders of an organization called Illuminodes. And really what I'm going to talk about is who owns your health data and what we're doing on Nostr and what we're building. We're building the future of medical sovereignty. Can you do the next slide? All right. I'm going to start off with this, trying to interact with you guys a little bit. We're in El Salvador right now. Shout out to the most common name in El Salvador. First name. One? One. Okay, cool. Shout out to the most common surname in El Salvador. One, Res? Well, it's really hard. There's a lot of noise here. We'll go with Juan Martinez. How about that? All right, cool. So picture this. Juan Martinez comes to the doctor and comes over to the doctor and sits down and says, "Hi, my name is Juan Martinez. This is my situation." The doctor looks him up on his computer and says, "Juan Martinez is all cool." And don't know what that was, but anyway, all good. And after a consultation, he says, "Juan, you need to take this drug, you need to do that, procedure, etc., etc." And Juan Martinez comes back after a few months, and Juan Martinez is not in a good state whatsoever, right? He's in a bad state. And it turns out that as much as the doctor was trying to do the right thing, in this database of people, in this list of people that he saw, he chose the wrong Martinez. Can you imagine this happening? This happens all the time in the world, okay? And why is this? This is because the way that the world works right now is we actually don't control our own health information and our own health identity. If we could control this, and if we would actually be the ones in control of this, then this stuff wouldn't happen. So that's right now the situation in the world. Example, with my own family, my dad has gone through a big operation, triple bypass. He's close to 80. And in his situation, it's like, okay, I have to ask the doctor, I have to call this person, they're going to call someone else, talk to someone else, for him to actually just look at what he's about, what his health information is about. He doesn't have the ability to say, okay, this is my health information, I can share it with you, you advise me on that. He is totally reliant on these big software systems and these centralized organizations that control that data, and he has zero control. He can't give, say, the medical information to me or my sister and say, hey, can you find out and get a second opinion or a third opinion or anything like that. We are totally subject to these big organizations and big systems. Another one, of course, is a situation that I had where a guy from the US told me this story. We had an MRI done in an MRI facility. He came back the next day or whenever they had the results, and they said, "Hi, I am such and such. Can I please have my medical information and my MRI results?" And they blatantly said, "No, you can't." And you go, hold on, this is the inside of my body. It is my property. But no, that's the way the world works. We do not control our health identity, and we definitely, therefore, don't control our health information. So, what is it? If you think about it further, we basically live in this hybrid world right now. You know, we've got our physical existence where we live next to our neighbors and hello neighbor, how are you going, right? And we can go there and visit them, and we can go to different places, and we can actually go somewhere else again if we don't want to be there. We can remove ourselves from a specific environment. We can't remove ourselves in the digital world that we live in, because if you think about it, our lives are almost a hybrid situation of a physical world and a digital world. And that digital world is growing and becoming more and more relevant every single day. So our situation is that we now live in a hybrid world where we cannot remove ourselves from the way that we can remove ourselves in this physical environment. So what has happened? Right now, these big organizations, they control our data. They manipulate our data. I mean, I'm guessing you guys have seen many, many statistics over the last 5 years that you go, yeah, I don't know if that's really true, right? Specifically in the health space. So our data is controlled, our data is manipulated, and our data is centralized. There's a few organizations out there that you guys all know called Amazon and Oracle and Facebook and stuff like that that actually control our data. We have zero say over it, and that's what we're trying to resolve. All right, good time to have a drink. So, what are we doing? We are building a solution for the real world. We call it the Salud Protocol. I'm going to have a drink first. Salud is the word for health in Spanish. And Salud also is an acronym for Sistema de Administración, Libertad, Único y Descentralizado. Did I say it right? Cool. All right. The Salud Protocol is built on the Nostr protocol, which also is an open source protocol that no one controls. It's open source, as I said, it's built on Nostr and the Bitcoin protocols, and therefore it's also decentralized. Again, no one controls it. There's no single point of failure. As you know, as I said before, in these systems that we're using today, there are centralized software companies, centralized database companies, and they control your information, and you cannot do anything about it. It's the way the world works. The other thing is, what we're doing in the Salud protocol is we're integrating this thing called HL7 Fire. And HL7 Fire is a standard that's been around for close to 30 years around the world that is actually a way of how information is structured and sent in the health industry. So there's specific ways that data is structured and sent, and we're actually locking that into the health and the Nostr protocol being part of the Salud protocol. So all of a sudden you've got a situation where we're creating a global standard inside this Nostr protocol. I sort of call it the Trojan horse because it's already being used. We're just putting it on Nostr, and as a result, make it easier for people to interact with this Nostr protocol. And the best thing of it all is that we're in a country, El Salvador, where we have found someone to actually work with. So we worked with an organization called Paravida. Paravida is a hospital here in El Salvador. It's been around since 1981, I think it is. And they are so innovative in their thinking and so willing to say, we want to have a change, that they were willing to say, okay, we're going to team up with you guys. Thank you. We're going to team up with you guys. We're going to work with you, and we're going to help you build out this Salud protocol to hopefully change the world at the same time. So what does it mean? It would mean that all of a sudden, the patient now controls their health data and their health identity. We can extract ourselves from it if we don't want to be part of it. It means that the doctor actually is in charge of what he advises to people as well. No one can manipulate that information either. It means that because we actually own the keys to our health data, it means that the data is all of a sudden genuine and verifiably genuine. Like I said to you before, right? The data that's in there right now, that in these massive systems, is fully manipulatable by third parties, and we don't know what they're doing with that. Now we have a way where, with a set of keys, just like with Bitcoin, we can actually control this data, and we can verify if someone's been playing around with it. So all of a sudden, we've got genuine data and verifiably data. So there's no more playing around, no more manipulation. What does that mean? That anyone that is playing around with our data can now be held accountable. Think of it this way. If I have a Pfizer or a big organization that's doing a trial with, say, 1,000 people, 10,000 people, if we deploy this Salud protocol to it, we can basically say, hey, hold on, you came up with these wonderful statistics and these wonderful results, but show us if that is truly the case. Show us the receipts, show us that these bits of information were actually signed off by the owners that actually hold the keys of that medical information. Again, what we're doing is we're standardizing the globe because we're actually putting them on a global standard like the HL7 medical data standard. And the funny thing is, it is really, really cheap to deploy the Nostr technology. So you can imagine that in a country like this, a country like El Salvador, a developing country where there's still a lot of manual, hospital work done, we can basically digitize a country like this in a very cheap way and at the same time lift them to a level of standard where the rest of the world is and maybe even beyond. This is a little video. Can you turn up the volume? So this is about what we've been doing, phase 1 at the hospital. I still can't hear it.
Now phase 1, that's live.
Not that one.
Surely people are getting on board.
Anyway, you guys can read, right? Is that correct? You guys can read? Yeah, good. I don't like seeing myself, and certainly not that many times either.
Identity.
Today, we're here at the Paravida. Hospital. This hospital is doing some groundbreaking stuff.
First world-class hospital running on a sovereignty-based decentralized global health ecosystem.
So what we're doing with the Salute protocol is we're giving back the health identity to the patients, to the individual.
So we're now phase 1, that's live, and slowly but surely people are getting on board. Phase 1 is where we can actually have the hospital and doctors and stuff like that interacting with their own identities, with their Nostr identities. Once we know all that's working, then the next phase is, okay, now we need to integrate it into the patients.
And for someone to already have a functional business, an operating business, it's almost like a huge risk to think,
Absolutely.
okay, I'm going to allocate energy and resources into getting this off the ground.
Yeah.
Like, that's very innovative.
And here she is. This is the president of this super innovative organization.
Yeah, and something that it's kind of important to say also, it's my dad's vision and my vision has always been to be able to help people who are not able to pay for like very expensive medical care. We always try to give free consultations, at least 1 or 2 free surgeries a year.
So not just innovative, but also humanitarian as well.
This used to be my house. Yeah, this was my living room, and well, it's actually all changed, but...
So there's a new doctor that hasn't gotten onboarded to Nostr yet, right? Yes. So we're going to go and show him how to do it.
Since there were 2 people making the appointment, sometimes we had 2 doctors at the same time. So this will help us not to make that mistake.
So it's solving more basic problems as well as the sovereign identity problem.
Now this hospital is basically being lifted into this whole new way of digitizing their own administration infrastructure. And the bonus is, all the information and all the identities are going to be verified, true, honest, controlled by one identity. So it's not just a little bit. This is way bigger than you can see.
So first he has to log into paravidaescalon.com, and this is our webpage. He needs to create a new user.
He's probably locking up his keys now and his information, and then he's made his official new Nostr identity.
So he already did the reservation. Now we have to check on the hospital area. So we have all the appointments that are already made by real doctors and real appointments.
No double bookings, no double spendings.
¿Cómo siente usted la diferencia de estar usando una aplicación donde se registran?
Ya nos ayuda un poco mejor a llevar un control porque se nos acumula todo. Ya automáticamente ellos pueden ver que hay espacios y lo pueden reservar ellos de una sola vez.
Another, I think, exciting thing is the fact that you guys are going to start looking at medical tourism and getting people from overseas to come over here, and that's pretty cool.
That has been a project that I've been wanting to do for several years. So it will be very important for us to be able to receive patients from all over the world here. We really need to motivate people to come here and not just for surgery, but we want to plan like a really nice trip to be able to see El Salvador, the beauty of El Salvador, the beaches, the lakes, the mountains.
And then obviously on top of that, the idea that Paravida will be accepting Bitcoin,
Yep.
that Paravida is a hospital that's actually working on, sovereign identities and health identities. So Paravida means for life, right?
Yes.
So this is for life. It's definitely a lot of work still to
A
do.
lot of work.
But yeah, we're on our way, and hopefully we can change the world for the good. So.
Do you have any closing words you'd like to say to the world?
Just be positive. Sometimes you don't think you can make something meaningful, and suddenly it appears in front of you like angels, like Fabian, that help you realize how important your job is. So just trust yourself and believe that you can do a lot more.
Today, we are here at the Paravida Hospital.
All right, so pretty exciting. Developing countries sort of in a position right now to actually lift themselves even above where the Western world is, where we can accept Bitcoin, where we can control our own identities, where we can have verified information, and where we are actually in control again. As I said, the last 5 years has not been pretty, and we all know that. And I don't think this could have worked if we didn't have to go through all that, right? Tomorrow, we're actually going to have a panel, so come and join us tomorrow at 10:30. The importance of medical sovereignty for an honest and freedom-focused society. And we're obviously building that on Nostr. We have the hospital president there. We have myself. We have Maya, as you probably know, the president or presidential candidate of Suriname. What does it mean for a whole country to think like this and have technology like this to support it? I mean, that's pretty amazing if you think about it, right? And then, of course, Andre, he's in the big data space. Because if you think about it, if we now control, I don't know what that is, but if we now control our health information and control our health data, what does that mean? That means that all of a sudden we can hold accountable governments, we can hold accountable software companies, we can hold accountable drug companies, and they actually have to ask us for our data before they can do anything with it. So all of a sudden they have to do the right thing, because otherwise we're going to go somewhere else. And that's powerful. So I think this is far more than just health. By the way, also tomorrow, if you want to know more from a technical perspective, my business partner, 42 Papusas, is up at 4:40. He'll teach you how to create an authenticatable and verifiable medical records. I mean, this is open source stuff. So yeah, go and see that and experience that for yourself. But what are we doing? Are we actually creating? I mean, if we can now control our data and no one else can, are we actually democratizing society through data? Because if you think about that, that is world changing. So I keep on saying, and maybe people don't agree with me, but I think we're actually democratizing data and building a data democracy that we couldn't have done before on Nostr. That's it. Obviously, anyone that wants to support us, reach out to us. We're obviously on Nostr. There might be some stickers. My other half might have some stickers or something like that with QR codes where you can connect with us. We're always looking for people to help us out and help us fund this initiative. It's obviously not for free. And if there's people that say, we've got skills, I want to share them with you, I want to, help you out with any skills, again, reach out to us on Nostr, of course. That's it. that's the story for today. I don't think there's any more slides. And thank you for your attention. Oh yeah, do you want to have any questions? I can do questions, yeah. Don't get them too technical because I'm not the technical guy.
I was actually going to ask if hospitals and clinics need to run their own relays to be part of the Nostr network to integrate this.
So I missed what you said, sorry.
If the hospitals need to run their own relays.
No, they don't have to run their own relays. No, that's the beauty. Time is off. One last one.
I was wondering if there are any incentives for healthcare providers to jump on board the system.
It's really hard to hear.
I was wondering if there are any incentives for healthcare providers to jump on this system.
Yeah, so remember we've just deployed phase 1. So phase 2 is where we're actually going to be working with patient identities and pathology data and wrapping that all up into, again, over time will be called the Salute protocol. And I think the opportunity lies right now in developing countries because these are the ones that in a very, very cheap way, through using these Nostr technology, lift themselves up to where the Western world is at. So I think that's the biggest incentive right now. I think if we actually reach out to, I don't know, say a big hospital system in the US, they're probably going to say, see you later, I'm getting too much money from these deals that I've got going with these selling all my data. And I think, to give you an idea, who knows what the actual number is, but the value of health data in the world is about $2 trillion. That's being sold out of your pockets because it's your data. And if we can flip this around where they say, hey, you're not going to get any of my data if I say no, then they're going to have to ask you. And then what we're going to do is create, in a sense, the true prosumer environment where, yeah, data is valuable and we need it, but now they have to ask people that actually own that data, which is us. So, again, thank you.